The tone of today's report is set on page 1. Dear Secretary of State, the National Health Service is in serious trouble. A statement the Prime Minister himself ran with today.
Until this morning, we didn't know the full scale of the damage, which is laid bare in the report. Even Lord Darzi, with all his years of experience, is shocked by what is discovered. It is unforgivable.
Lord Darzi, who is himself a surgeon, was asked to do a rapid report into the current state of the NHS, to give a diagnosis but not a prescription.
The big picture finding is the NHS is in a serious, critical condition. But the vital signs are normal, which will suggest that we can do something about this. To do it well, we need to engage the whole staff, patients, the public, the political leadership, all aligned to make that change happen as quickly as we can, because we can't wait.
He also says he doesn't blame anyone, but throughout the report is heaps of blame. The 2010s, the most austere decade since the NHS was founded, he says, and he talks about starvation of investment, confusion caused by the 2012 NHS reforms, and the pandemic, which came with resilience already at an all-time low.
In terms of the spending in the last decade, we inherited an absolute economic mess from the Labour Party. The deficit was double what it is today, and unemployment was almost double what it is today. Inflation was higher, the economy was not growing in the way that it was at the time of the general election. And so we had to deal with the public finances. But the one thing we always did was protect NHS funding.
The problems Lord Darzi lists are familiar. Long A&E waits, hanging on the phone for the GP, poor cancer outcomes and record waiting lists. Mary Waterhouse knows all about those. It's taken 2.5 years to get a date for a knee replacement.
I feel like I'm bouncing backwards and forwards from one waiting list to another, and it's really frustrating. I've got a mobility scooter. I can't walk anywhere because I start crying with pain. It's the pain just, you can't describe chronic pain until you're actually going through it. Nobody can see the pain. Nobody understands the pain except you.
The Prime Minister talked about the need for fundamental reform, but it was in broad headlines.
Moving from an analogue to a digital NHS. We've got to shift more care from hospitals to communities. We have got to be much bolder in moving from sickness to prevention.
And there were, to some in the room, gaps in the report.
You talked earlier about integration of health and social care, and you also talked about the people stuck in hospital tonight who don't need to be there. When is your government going to tell us what your plans are for reforming social care?
Well, we need a national care service. That is our ambition. That's the work that we will start on. I want this to be done as consensually as possible because it's difficult. I want to be cross-party. I want to involve as many people as possible.
The report also found that while staffing levels had improved, productivity had not, and part of the problem is the lack of capital investment, computers that don't work and ceilings that leak. St Mary's Hospital in West London has a £239 million maintenance backlog. This room was once a ward, now it more often houses pigeons. There has been no mention today of extra funding. In fact, the Prime Minister was quite explicit, no more money without reform. And yet Lord Darzi is equally explicit. There's a £37 billion shortfall in capital funding, he said. And that is pretty obvious when you're standing in this corridor of this major London hospital and looking at the state of disrepair. And looming on the horizon is winter, with the potential for more delays, more ambulance queues, more overflowing A&Es. And they will need dealing with well before a promised 10-year plan for the NHS is even written.
And Victoria joins me now in the studio. Victoria, that pledge of no cash without reform, just delve a little bit deeper into that.
Well, they seem to be very determined that they're not going to give lots of extra money, despite I suppose, historic precedent, and we saw that with the Blair government, where in the end they did throw money at the NHS to try and fix it. So what they have in front of them is a short-term, a medium-term and a long-term issues. At the short term, as I said, they've got winter coming. Now, some money has already gone into that. That happens every year anyway. Medium term, they have that pledge to reduce waiting lists. Now, again, how they're going to do that without putting extra resources in is quite unclear. In the long term, there are things like prevention. You know, you're going to need more school nurses. You're going to need more public health officials. You're going to need to put more effort into, for instance, children's health. Now, there was something today. There was a hint of that. They've said that they are going to introduce the 9 p.m. watershed on junk food advertising. So that's obesity they're talking about there. And the Prime Minister said that he is prepared to make some difficult and maybe unpopular decisions, so maybe something on that hint at banning smoking in public.
Huge challenges, though. Victoria, thanks very much. Well, a short while ago, I sat down with the Health Secretary, Wes Streeting, and I started the interview by putting it to him that we won't find out what the NHS reforms will really look like until next year's spending review.
Well, of course, lots hangs on the budget and the spending review, and we're not going to make promises we can't keep or the country can't afford, like the last.
But you know what reform is, do you, in your department?
Yeah, if you hanging on each of those shifts, we've already given some clues about what that might look like. For example, the shift from hospital to community. In the first month or two in office, we've already employed another 1,000 more GPs, left unemployed by the last government. They're going to be on the front line by the end of the year. That's brilliant for patients. It deals with the access issue and the unemployment issue.
Let's talk about some of the actual sort of nitty-gritty of this, because you've said insistently that there's no money without reform, but don't you need money to kick-start reform?
It's investment plus reform that delivers results, and the lesson of the previous government is that if you just pour more money in, as they did from 2019 to 2024, way more staff working in our hospitals, but less productive because we put the wrong people in the wrong place with outdated technology and a rotting estate. So
there will be investment.
Well, around the spending review, my priority and the Chancellor's priority is that kind of technological investment to deliver the big productivity gains that patients will experience through ease of access and staff will experience because they're not working with creaking, outdated IT.
And the Chancellor's behind that, putting extra investment in. I mean, what kind of scale are we talking here?
She is behind that. I recognise, the whole government recognises the challenge she has, both plugging the £22 billion black hole we inherited this year and the weak foundations of the economy we'll still be grappling with over the coming years.
So when Sir Keir Starmer says, I'm not pouring more money in, it's not actually quite right, is it? Because you are intending to pour money in, but it will be strictly pegged to reform, is what you're trying to say.
Well, I'd say two things. Firstly, as Keir said, no investment without reform. We've got to see improvements to the way that the NHS spends the money and the outcomes we're able to achieve. And the second cautionary note, Lord Darzi's right. You know, we've seen a massive underfunding over the last decade. We can't correct that in 1 year or even in one spending review over the next few years. So don't expect to look at the Darzi report and see Rachel fund the entire backlog of underinvestment in one go.
So it'll be a gradual process of investment, but a pressing concern. The winter is looming. You're expecting, presumably, to have to once again put your hand in your pocket for a winter crisis in the NHS, are you?
No, I've been very clear with the NHS. We're not going through this annual round of cash injections for winter. What we are going to do is recognise that this is going to be a difficult winter, to put patient safety, dignity and comfort first and foremost, and to, through the spending review and through the reform agenda, get back to where we were when we were last in government, where we didn't have these annual winter crises and where they didn't get worse and worse every single year.
But you know that you're going to be asked for more money this winter. You're really going to say no?
I think people have got the message that there is a £22 billion black hole in the public finances during this year. And this is why
Is that a no, then?
This is why,
just to be clear.
Of course it is.
You all say how shocked you are at what you found in the NHS. You know, Keir Starmer said that, you've said that, Lord Darzi says it today. Should people be scared about getting sick today?
Well, I can only speak from my own experience, really, which is that, you know, if I think about people that I'm close to, I can think of examples. myself included, where in my case my kidney cancer was diagnosed early. I was referred to treatment quickly. And as a result, I'm talking to you today cancer-free and likely to, I hope, live a long, healthy and happy life. There are other people in my family who the NHS didn't reach in time and whose outcomes have been far worse. And that is the tragedy, that the NHS is not always there for us when we need it. And you look at the damning statistics in Lord Darzi's report, the numbers don't lie.
So we should all be a bit scared, really, about getting sick?
I don't want people to feel afraid to pick up the phone and dial 999 if they need an ambulance. I don't want people to not see a GP appointment in case to see a GP or book an appointment if they feel like they're going to be a burden on the system. If people need to access healthcare, they should come forward and do so in the normal way. What I am honest with people about, though, and what I will not shy away from, is the fact that the NHS is not always there for us when we need it, that it is not currently good enough, that it is broken, and that we need to fix it.
What impact assessment have you done about the risk to pensioners' lives, to their health, from means testing the winter fuel allowance?
Well, the Chancellor will do the usual impact assessment around the budget and the spending review for all of her fiscal measures. That's the normal way of doing things.
So it hasn't been done yet?
The confidence I have is that, and I know this is tough for people, and I know that this has not been popular with people. I'd say to pensioners who are thinking at the moment, well, why us and what about everyone else? That decision raised £1.5 billion. The black hole is 22. There are harder choices still to face. The Chancellor and the whole government with her are facing up to those choices. And I know the medicine doesn't always taste great, but it's a lot better than not taking it.
Wes Streeting, thanks very much.
Thank you.
Well, total government debts are expected to almost triple over the next 50 years, according to the Office for Budget Responsibility. It's warned that this means the public finances are on an unsustainable path. Our economics reporter, Neil MacDonald, is here. Well, Neil, just draw the lines between our top story tonight and this story that we're talking about now.
Well, the short-term pressures on the NHS are clearly massive, as we saw. Long-term, those pressures are set to grow. The government's own economic forecasters think that this will produce a relentless increase in public spending and then a big increase in our national debt, the total amount the government has borrowed on all our behalves. This graph shows you how the amount of our economy we've been devoting to health has been growing this century. OBR sees it carry on growing relentlessly over the next 50 years to more than 14% of our national income.
And what's driving this shift?
This is about the tax and spend timeline of all our lives. Let me show you that divided into 10-year chunks. On the left, got children, they don't pay taxes, but we do spend money on their schooling. When you go to work, you start to pay taxes. You don't make many demands on the NHS. From 70 onwards, that changes. There's more on your healthcare, there's more on your pensions, and so on. We talk a lot about an ageing society. What that means is that more of us are ending up on those columns on the right.
So how does that change the public finances then?
Well, this huge social change, the OBR thinks, is going to completely reshape our public finances as well, as the state spends more and more. And if we don't raise taxes, that gap has to be filled in with borrowing. And this is what they think it's going to do to our national debt. From about 100% of GDP at the moment, they see it going up pretty relentlessly up to over 270%. That would be higher than the peak we reached when we were fighting World War II. Now, the OBR has some questions about whether we'll actually be able to borrow all that money. If we can, it does come at a price. We would be paying, they think, about 12% of our entire national income each year, paying the interest on that debt.
I mean, this is all incredibly depressing. Does the OBR have any bright ideas about what to do?
Well, boosting our poor productivity, we've spoken about a lot. It turns up here as well. Making our workforce, making our companies more efficient, growing the economy, it gets bigger, there's more tax revenues. And I can show you, if we could achieve the productivity growth we used to manage in the 60s and the 70s, that's what happens to our national debt. It doesn't grow at all, it actually falls. So, more productivity. Of course, economists do not agree on how to deliver that. Failing that, you could put up taxes for the NHS, but right now, Labour and the Conservatives don't seem to want to talk about that.
The productivity puzzle as ever. Neil, thanks very much. Now, an indication of just how bad our health problems are can be seen in figures given exclusively to this programme by the International Longevity Centre. They show that life expectancy has stagnated in the UK And we're an international outlier, as around 2/3 of advanced economies have seen increases in life expectancy in the last decade. The research also shows that the most important factor in living a long and healthy life is wealth. And as Kieran Moodley has been finding out, the divide in Sheffield is particularly stark.
From high up here, Sheffield is one vast city, a unified concrete block on the edge of the Peak District. But down on the ground, it's a tale of two cities, where in the affluent west, the problems of deprivation on the east side appear only in paintings.
I think a lot of people who have more money would never come to an area like this, or they would drive through it.
Over in Burngreave in Sheffield's east, Patrick Moran is running a drop-in for men recovering from mental illnesses.
When you're unemployed and you've got disabilities anyway, you haven't got the money to do various things, so this costs us nothing. The only thing it costs is your time, and it gives you a purpose.
This part of the city has higher unemployment and more people on benefits. And today's NHS report spoke of the impact of deprivation on mental health and the lack of access to services.
Places like this do help you. I don't have the money, I don't have the finances. I can't get things sorted out because I get rebuffed and refused all the time. It just takes so long. And when you're suicidal, you haven't got that long, so you need help.
When I lived over this side of town, it was really hard to get to see my GP. But now I live over the posh end of town, I can see a GP like that.
The impact of poverty in Burngreave means people here are more likely to live less healthy lives and not live as long as those in other parts of the city.
There's loads of different things that come into play, whether it's housing, whether it's the environment, access to green spaces, access to disposable income, and the ability to kind of eat more healthily, do exercise, and all of those things that cost money.
And have those inequalities been exacerbated by austerity, COVID, the cost of living?
It's clear to see that in the last 14 years, the decline has been significant for people living in deprived areas. And so, yeah, austerity has played a massive part in that. And then COVID, I think, has just set us back further.
To see the stark divide, just take the number 83 bus, a route that has become synonymous with inequality in Sheffield. The bus runs from east to west, travelling through Burngreave and into affluent Eccleshall and Fulwood. Life expectancy differs by a whole decade between these areas. For women, it's 89.1 in Eccleshall and 77.7 in Burngreave. For men, it's 84.3 in Fulwood and 74.2 in Burngreave. More broadly, according to a new paper from the International Longevity Centre, after rising for 60 years, life expectancy for people over 50 across the UK is now 2.3 years lower than anticipated. The UK is an outlier, with 2/3 of advanced economies increasing their life expectancy between 2010 and 2020. I take the bus with Carl Lee, a geographer who has lived in Sheffield for more than 40 years.
I think the divide is sort of set in stone by the sort of, if you like, urban organisation of the city, where the different residential groups live, where different types of housing exist.
If the city's divides are so entrenched, can they ever be eradicated?
We can reduce those inequalities, that's for sure. We can improve health, we can improve education, we can improve economic opportunity. But can we level it out? Almost certainly not.
The bus takes us to the west, where the houses loom large. We make it to Eccleshall, home to artisan shops, delis and bakeries. A different world. A divide so great that even Gina, who's lived here all her life, is unaware of the other side.
The 83 I can get is next to my road, so it's the bus that I always get into town. And that goes to Chapeltown, doesn't it, the 83? Yeah.
And it goes to Burngreave as well?
And Burngreave, yeah.
Are those areas you go to?
Literally never been. Never been.
Does it make you think any different about the city, that there is such a stark divide?
I don't necessarily feel like ashamed of living here and angry at the people that live here. But there's obviously someone in power in this city is not organising things properly and isn't asking the right questions and isn't looking after everybody.
Sheffield is a tale of two cities, but one repeated throughout the UK, where history, housing and employment affects the lifestyles and livelihoods of everyone. The NHS can help cure some of those ills, but bridging society's divides is a much greater challenge.
So how can the NHS be reformed to better care for the people of Sheffield and the rest of the country? I'm joined now by Sarah Woolnough, who's Chief Executive of the King's Fund, and Philip Banfield, an obstetrician and Council Chair at the British Medical Association. Sarah Woolnough first. Keir Starmer kept on talking about reform, but he didn't really say what it was. Can you give him any pointers?
Yeah, well, he said they're going to develop a detailed plan. But as an example, the Prime Minister talked about shifting more care out of hospitals and into the community and primary care settings. And
that's a top-down reorganisation, isn't it?
Well, it doesn't have to be, but it does require a bit of rewiring. At the moment, hospitals get paid by how much activity they do. They're incentivised to suck patients in. So if we can rewire the system to make it easier for people and patients to access primary care, to better measure what's happening in primary care, and to give primary care, for example, the technology it needs to make it easier to share patient records, that's a starter.
Right. Well, that's a very good starter. Philip Banfield, to do that kind of stuff, does the NHS need more money to kick-start that kind of reform, in your view?
Well, it does need more money. You can't suck care out of hospitals and transfer it to general practice without a consequence to it. You know, either you have to do less work in the hospitals temporarily. There's no doubt, though, that the amount of money that's been put into general practice has been shrinking as the costs have gone up. And this is the key to opening up.
Let me just get you to fact-check the funding issue, because there's been a lot of dispute about whether the NHS is underfunded compared to comparable countries. You've crunched the numbers, haven't you?
We have, and we're neither a leader or a laggard. We're somewhere in the middle of the pack. Occasionally, it's harder than you might think to compare our funding to other countries. Where we have underinvested, there is no doubt, is in capital. So that's buildings, that's estates, and that's technology.
But not in GPs.
Well, not necessarily in GPs, but comparatively versus hospital doctors, we've seen more money of the pie go into the acute sector rather than primary and community settings.
I mean, I'm being a bit facetious, but, you know, the BMA has been described as a major drag on reform by Professor Sir John Bell today. Are you the blockers in this prime ministerial plan?
We're really keen for change. We've got doctors using computers that are decades old with Windows XP. We're handwriting prescriptions when they should be electronic. We've got operating theatres with ceilings falling down. So
but John Bell also quoted the example saying that he accused you of blocking this new cholesterol drug because he said GPs said they weren't getting paid enough to inject it. Is that the kind of thing you're up to?
Well, I would have a different version of that, having spoken to the BMA president that was present in that meeting. What Sir John Bell did was to fail to sell it in the appropriate manner to the GPs. But you know, there are costs to things, and what you can't do is to fund things in hospitals and then not fund them when they're transferred into general practice.
Right. Well, I mean, one of the big problems is social care, isn't it? And that's always been at the heart of the NHS's problems. And yet again, it's kicked into the long grass, talk of a royal commission. We don't need another royal commission to gather dust on reforming social care, do we?
We don't, and it is an area that needs urgent attention. Our social care system is not fit for purpose. The bottom line is there are more people requesting care and support and fewer people able to access it. And the government is pretty thin in this area. So we very much need to see action. We need to see reform. We don't have the workforce, but we also know that crippling costs mean that families and individuals are simply not able to access the care they need.
Social care, is that the sort of holy grail here? If we can get political consensus on that, that will make your jobs a lot easier?
Well, it would. I mean, the Darzi report found 13% of beds overall in England were filled with patients fit for discharge. Hugely frustrating for our surgical teams to not be able to admit when operating theatres are free because there's no bed to put a patient in.
Are you confident that because Keir Starmer can reform the NHS?
I think we have to have hope. Public satisfaction with the NHS is at the lowest levels it's ever been. I don't think it will be a surprise to people and patients what's been said today. We need commitment, sustained commitment to kind of reimagine our care system and our health system, because we're working off a 1940s model in 2024.
In a word, are you optimistic?
I'm always optimistic. If you provide us with the resources and the facilities, we'll get on with the job.
You said resources. He says no money without reform. You've got to reform first.
Absolutely. No problem with that at all.
Right, so he's got a willing partner. Professor Philip Banfield and Sarah Woolnough, thank you very much for joining us.